Leader of the Official Opposition.
Mr. Speaker, the one thing that is critically important to every New Brunswicker is their health and the health of their loved ones. We have the privilege and the responsibility of hearing stories every day from people who are waiting and waiting to receive the care they need, whether that's at an emergency room, at a clinic, or waiting on the waiting list for a doctor. We're here to get answers for New Brunswickers. So my first question is about leadership, responsibility, and accountability. The government put a health plan in place in 2021. The Premier then fired a CEO, blew up the boards, put trustees in place, and started taking all the health decisions himself. Lately, we understand that he's pulled out of health micromanagement because he's been distracted by some other things. So your answer will impact how I direct my next questions. New Brunswickers want to know, who should we hold accountable for the state of our healthcare system today?
The Minister of Health.
Well, Mr. Speaker, it's a real privilege for me to stand up in the third session of the 60th Legislative Assembly of New Brunswick and take a question on health. Mr. Speaker, we know how important health is for the people in the province of New Brunswick, and I would infer the fact that we're asking health questions as opposed to throne speech questions, that the opposition will support the throne speech of this government. Thank you very much. Appreciate you doing that. Mr. Speaker, there has been a significant amount of work going on in the healthcare department and within the RHAs and all the service providers here within the province of New Brunswick over the summer. And over the next number of days during question period, I'm more than happy to update the opposition on what has been going on. But one of the main things I think that is so important here in the province of New Brunswick is that the RHA boards have been put back together with an additional collaboration board that, again, is going to address all the issues.
Time, Minister. Accepted opposition official.
Thank you very much, Mr. Speaker. It's good to know that the Minister of Health is going to be the scapegoat that the Premier can blame the lack of results on the healthcare system for, so appreciate Mr. Fitch getting up. I would be happy to talk about health from the speech from the throne, except that there wasn't anything in the speech from the throne on health that responds to what New Brunswickers are looking for answers on. New Brunswickers are waiting. Les Néo-Brunswickois attendent. Ont besoin des réponses quand ils attendent en ligne pour des soins primaires. Ils veulent savoir où est-ce qu'ils sont dans cette ligne. Est-ce que vous pouvez, le Premier ministre ou le ministre de la Santé, nous dire combien de personnes attendent sur la liste pour des soins primaires aujourd'hui? How many people are on the waiting list for primary care today?
Before I call on the Minister, I would just remind you that it's called by their department or their riding, not by their name. Minister of Health.
Yeah, you know, I would normally quit, learn the rules or resign, but I'm not going to do that today, Mr. Speaker, because this is a very, very important item. And actually, it's good news. Good news that the opposition doesn't want to hear. We could talk about hip and knee surgeries and how that wait time has been reduced significantly over the last number of months. Mr. Speaker, we could talk about the cataract surgeries and how significantly those have been reduced because of the legislation that was put in place by this government on this floor. They opposed it. They opposed that we would take care of the people that have been waiting so long to get cataract surgery. So once again, so soon, I find myself holding the opposition accountable to what they are saying here. And Mr. Speaker, even within the throne speech, there were a number of initiatives that were highlighted that showed that people are getting the service. We know the work's not done, and we're going to continue to do the work so that the people continue to get the service.
Accepted opposition official.
Thank you, Mr. Speaker. I hope the Minister of Health will answer this specific question because New Brunswickers are concerned about primary care. We speak to parents every day that are calling, trying to get an appointment, wondering where they are on the Patient Connect list, hearing they might get put on HealthLink, waiting to hear, finding themselves on HealthLink, still not having a primary care provider. And they want to know where they are in the line and how long the wait is going to continue. So could the Minister of Health please answer for New Brunswickers how many of them are waiting for primary care, not hip and knee surgeries, not cataract surgeries, how many are waiting to get access to the basic care that their families need?
Minister of Health.
Well, thank you very much. And again, Mr. Speaker, there's more good news when it comes to people waiting for primary care. We know there's more work to be done. The population of New Brunswick has grown by almost 100,000 people. Mr. Speaker, 100,000 people requiring education, doctors, nurses, primary care. So yes, we know that there's going to be people that are concerned and about their health care, and we are reacting to that. Mr. Speaker, back in the summer of 2022, 74,000 people were on the wait list for primary care for a physician. Mr. Speaker, because of our work with HealthLink, because of the people that have registered, there are 41,700 patients registered for New Brunswick HealthLink, and clinics have been established in Moncton, Dieppe, Dalhousie, Fredericton, Woodstock, Miramichi, Bathurst, and we are continuing to do the work. So right now, Mr. Speaker, the good news, there's only 20,000 people on that wait list, and we're going to continue to work for them.
Thank you, Mr. Speaker. I'll just check the math. You said 74,000 people with 41,700 on HealthLink, so to me that leaves 33,000 people that are still on Patient Connect. So it's unfortunate to hear you say that it's good news that there's more work to be done and that there's 100,000 people arriving here that I think we're going to add to that Patient Connect list. But let's talk about HealthLink. How many people have successfully moved from HealthLink to permanent primary care?
Minister of Health.
You know, again, Mr. Speaker, I love the opposition, and they are going to, again, look at a number or something said and spin it or take it in a different direction. Or if they receive the information that's good news, they'll say, yeah, but. They'll want something else. They'll want something different. Mr. Speaker, so again, when we talk about the good news, the number of people that have been moved off, again, this list is changing all the time because we have new people coming off, people dropping off for various reasons because they found a permanent home. And again, when we look at the work that's been done in the various communities that I've talked about here, and we know that those clinics are going to continue. And it's not the final number. And you know, again, because the opposition always takes a number either out of context or it makes it changes the tone of it, I'll take that under advisement because, again, I'm sure they're going to take that number and use it.
Thank you, Minister. Time. Leader of the Official Opposition.
I'm happy to help the Minister of Health with the numbers if he doesn't have them at his fingertips. I believe it was at Public Accounts that the Department of Health said that about 2,000 people have actually received primary care and come off of this two-phase waiting list of Patient Connect to HealthLink. So 2,000 New Brunswickers out of 74,000. We'd like to know what your plan is because we appreciate that there was a healthcare plan that had deadlines and targets. Il y avait quelque chose de spécifique qui nous disait qu'en septembre de 2022, vous allez éliminer la liste d'attente. Puis après ça, c'était révisé. And it was revised again and revised again. I think the latest target that you put forward was June of this past year. But New Brunswickers want to know, what are you doing to eliminate the 72,000 people that sit on Patient Connect and HealthLink who are waiting for primary care in New Brunswick?
Minister of Health.
Well, again, Mr. Speaker, if the member opposite had a number, why didn't the member opposite put that number forward, as opposed to trying to politicize and weaponize it here in the floor of the legislature? That's what the opposition is. That's what the opposition is all about, Mr. Speaker, trying to despair the population of New Brunswick for the work that's being done in the healthcare. We know there's more work to be done, and that's why we're recruiting physicians and RNs and other healthcare workers all the time, Mr. Speaker, not just here in the province of New Brunswick, where we've increased the number of seats. We've increased the number of seats for RNs. We've increased the number of seats for the medical doctor practices. We've increased the residency seats. Mr. Speaker, the list goes on and on and on about what we are doing to provide primary care to the people of here in the province of New Brunswick. We know that HealthLink is a temporary measure, and that is unfortunate that, again, everyone doesn't get that. But as a matter of fact, Mr. Speaker, we continue to work.